So good evening again, everyone. I'm Paula Carey. Please feel free to call me Paula. And this evening, we're going to be talking about the differences between the roles for OT and for OTA. So along that vein, in terms of the content, we're going to talk about how it's best done as a collaborative relationship, and that there's different roles, that there should be different responsibilities for the OTR and the COTA. And then what supervision is all about. So we're going to be talking about that. Think about what questions you might have, because I love having questions at the end. All right. Whether it's about this content or something else, it's all open for discussion. First of all, we're going to stick to the content though. Okay. So please remember, those of you who've already been to office hours before, that this information is copyrighted. Therefore, you are not able to save it in any form whatsoever. So make sure to stay compliant with that ethical responsibility, both for this presentation and for other things that you are using for your exam preparation, whether it's a textbook or it's other videos. Make sure that you're not sharing copyrighted material. Please be very careful about that. I also need to tell you that TherapyEd is not affiliated with nor endorsed by the National Board for Certification in Occupational Therapy. And the NBCOT, OTR, and COTA are trademarked by NBCOT. So I did mute everybody upon entrance. Please keep your mic muted so that you don't get the background noise, except when you want to ask questions or when I invite you to share. I really do love to have questions and participation. I think we all learn best with that, actively engaging with the material and with each other. So let's stay connected and let's help each other out. We're all in this together. And I'm definitely here to help you on this content, as well as anything else related to exam preparation. So as you can see here, I asked that you use the chat box for the majority of questions. I'm going to keep going back and checking it, but realize that if I'm in the middle of talking about a particular content area, it's difficult for me to do it at the moment unless it's within that realm of what I'm discussing. But I will go back and scroll for it. If I happen to miss something, I'm going to ask you all to help me, and that you will just let me know if I've missed a question. Just ask it again. Okay. So before we get into the focus of the session, it's important for me to think about what you know about public speaking, for me to establish my credentials in terms of being able to talk to you about this topic. So I started my life in occupational therapy by going to an OT assistant program. So I'm very, very much in favor of OT assistants. And I went to, so that was a community college, Herkimer College, if anybody knows of that. And then I got partway through the program and realized I was an adult with 2 children, and realized that I just wanted so much more information. And so I planned it so that I transferred into a local OT program. So that was at Utica College. So I did prepare for and take the certification exam to become a COTA. And then I went to Utica College, got a bachelor's degree in occupational therapy, took that certification exam to become an OTR. And I hadn't been working for very long when I started teaching as adjunct, and realized that that was my real passion, that I wanted to be an educator along with being an occupational therapist. So I got a master's degree in adult education. And then I took many, many courses in disability studies. And I was near the end of my PhD program, and I realized that I liked disability studies, but I loved OT. I withdrew from that program. I enrolled in the doctoral program, the post-professional doctoral program at Chatham University. So I have an OTD as well. And I've been a part-time student for almost every decade of my adult life, and I've loved it. Now, it doesn't mean every year of that decade, okay? So I just wanted to share that with you. I'm very much into being a lifelong learner and helping people to pass this exam. I've worked for TherapyEd for 23 years now, and I love being able to, oh, so my voice was cut. Is it better now? Is it okay? All right, I'm hardwired, so it should be okay. Just let me know if you have any trouble, okay? So I've worked with therapy ed for over 20 years, and I'm a consultant, an instructor, a tutor, and also do online office hours, obviously. So it's a pleasure to be here with you this evening and talk about this specific content. So as you know, the exam's broken down into domains. There's 3 domains for the OTA exam and 4 for the OT exam. So this is domain 3 for the COTA exam and domain 4 for the OTR exam. So it relates to, it's worded a little bit differently for the OTA versus the OT. So it's professional standards, competency, supervision, management, those types of things. So for the OTR, that also includes topics such as research, ethics for both OT and OTA. So if you look at chapter 4 on the first page of the chapter, it gives you a brief list of the content for that domain. Excuse me. And NBCOT also publishes more specific information as to what's in that domain. So I have my books here so I don't forget. So for the OTR exam, that's 15% of your exam, domain 4. And for the OTA exam, domain 3 is 17% of your exam. So think about it. Although it's not the bulk of your exam, the bulk is intervention for both OTA and OT. So really make sure you know that well. But this information tends to be more concrete. You know the content, you know the rule, you know the process, you know the legal ramifications, whatever the questions relating to in this domain. So think about it. If you study chapter 4 well, you should be able to get the majority of that percentage of the exam. And then it helps you if you have difficulties in other parts of the exam. So do make sure to go over chapter 4 very carefully. And if you're not comfortable with that content, remember that you have textbooks, you have class notes. Therapy ed does not have every little tiny detail in there that may be on this exam. Plus, the way they word the exam, NBCOT takes the information, the content, and they put it in a different way because they want you to be able to understand the information and master it to the point where you can interpret what the question is asking and apply the content that you know in different ways to novel situations. So that's why you will rarely, if ever, have a question that specifically is content driven. You have to know the content, then be able to apply it and analyze it to find the best answer. So we're going to talk about the must-know information related to this topic. So think about that the OT, I'm going to talk about OT and OTA versus OTR and COTA. They're part of an interprofessional team or a transdisciplinary team or a multidisciplinary team, depending on the situation. But you need to think about it as a team approach. And who's on the team varies depending on the setting and the type of service being provided and the needs of the recipient or the client. So the team includes that client, their caregivers, their family, other healthcare professionals, and any reimbursement agency or personnel. And be careful on this exam in terms of, as I mentioned about the team, including the family and caregivers. Be careful about if it's an adult divulging information that would be a breach of HIPAA. If you don't have permission from your client or recipient of services to share information about them, then you can't talk to the family about it, even though they are in general considered part of the team. So realize that you need to know the roles and responsibilities of the other team members. That information is also in this chapter, but it's not part of the content we're going to address tonight. Okay, so make sure to know that information. Therefore, if you have a question and it says, this is the situation, what should the occupational therapist do, or what should the occupational therapy assistant do, and it's not within the domain or practice of OT, then whose domain is it? And that's why knowing the other members of the team and what they do, what their responsibilities are, would help you. Okay, I'm just keeping track of how many people we have. So realize that you have to think about this as a collaborative process. And what's an effective team? So you can find this information in the OTA Review and Study Guide. So RSG is Review and Study Guide, pages 74 to 75. In the OT Review and Study Guide, pages 76 to 77. So what influences the effectiveness of a team? It's the skill and knowledge of the members. For instance, if you have a team of all entry-level practitioners, they're not going to be as effective initially as a team that's been together longer and is more mature, more experienced. Mature is not just in terms of age, I mean professionally mature. And the stability of that membership. Think about teams that you've been on. If you constantly change teams, maybe you can relate to this in school. If you are in a group doing group projects, but you consistently have different groups, not one group, then it takes a while for you to be able to learn how to work with each other. Also, the commitment to meeting team goals versus meeting just an individual discipline's goals influences the effectiveness of a team. Communication is critical, whether it's face-to-face, written, in any form, whether it's in terms of your documentation or it's emails, texts, however you communicate. The composition of the membership changes depending on the needs of the client and the setting. It's very helpful if you have a common language. You need to be able to understand each other. So if you're working in a primarily medical-driven setting, you need to know medical terminology. You definitely need to know OT language as well, as expressed in the OT practice framework, but you don't want to fall into just using jargon and then other people don't understand you. I can remember as a student thinking, wow, wasn't it really neat that I learned all these words and I had a different vocabulary? But then I realized when I'm talking to family members, I need to, sorry, I'm just reading something here. I need to be able to express myself in ways that everybody can understand. That includes the client and the family members. So it's important that team members work not only collaboratively, but respectfully. And everybody is of equal importance. There's not a hierarchy that if there's a pecking order, as we would say with a group of chickens, if there's a pecking order, then that makes it a less effective team. So why do you need to know this information? Because you need to answer questions that reflect that effective collaboration, effective communication, that you know the different types of teams that are available and their strengths and limitations. You know all the potential team members and their roles and responsibilities. Again, if you're going to refer somebody or if you have a question as to which should the occupational therapist do and all the answers except for one relate to what another team member would do, then you could pick out what the OT would do. And make sure that you recognize the limits of OT practice and when it's time to refer to other people. So I have a question that's not directly related to this, but it's certainly something that I want you to think about. Who determines the practice of occupational therapy? Can you put that in the chat for me? Who determines what you can do as an OTA or you can do as an OT? Anybody else? Okay, so those of you who put down state law, you're right. So it's a practice act, meaning it's a law, it's a bill that's been passed through the state legislature, which determines, it describes and sets boundaries on what occupational therapy can do in that state. So it will say what the occupational therapist can do, and will say what the occupational therapy assistant can do. So there may be some variance from one state to another, but this exam is based on each, on national accepted standards. So it's looking at what's generally accepted practice. Okay, and NBCOT is looking at what's generally accepted entry-level practice. So if you have experience in occupational therapy in a different role, like if you're studying for the OTR exam, but you're already an OTA, or if you've been another healthcare professional, even a CNA, if you've been a CNA, if you've been in a different field like speech language pathology, recreational therapy, if you've been athletic trainer, so many different career changers I've met throughout my career. So if you're studying for this exam, you need to think like an entry-level practitioner. Okay, don't think experience, advanced level, entry level. The NBCOT wants to make sure that you are, and they always use these air quotes in their meetings, just good enough for entry-level practice. Okay, so another tip for you is as you're answering these questions, don't think like an OT or an OTA student. Now you are the practitioner. You need to think like the practitioner. So as a student, often the answer might be that you would talk to your supervisor, but now you are the independent practitioner and you're expected to be able to make decisions, understand situations, and make decisions and take action. So use that perspective when answering questions. All right, let me check. Okay, that helps? Good. So remember, each state's a little bit different, but NBCOT is looking at, in general, what's entry-level practice. So that's what we're going to talk about. There's three main levels as described in the Therapy Ed Review and Study Guide for both the OTA and the OT. Here's the page numbers for you. There's the OT or OTR, OTA or COTA, and the OT aid. So let me talk to you a little bit about the OT aid first, because the OT aid can only provide unskilled services. And they might not even be called an OT aid. They might be called a rehab aid or a transportation aid. There's different names depending on the setting. But what they do are things like provide support for the OT practitioners. So they might do setup, they might do cleanup, they might do transportation. They might help the person transfer if the transfer has already been learned. They might help a person transfer from the transport wheelchair to a chair that they're going to be using for therapy. Does that make sense? They're not teaching the transfer, but if the person already knows how to transfer, they can provide transportation and transfers. Questions on that? But they do unskilled services. So an OT aid cannot provide anything that's hands-on skilled services. They might actually touch the person in a different capacity. So like an OT aid or therapy aid could help the person go to the bathroom. Like they're waiting for the therapist and they need to go to the bathroom. So yes, an OT aid can help somebody do transfers. They can't provide hands-on skilled services. So they're not teaching the person the transfer. But if the person already knows how to transfer, they can be there and assist the person with it. Do you hear the difference? There's a difference there. Does that help? So it can't be just one type of transfer. So it's not just standby assist and min assist. It's if this aide has already been trained in how to assist that person and the person knows how to do that, they've demonstrated competency at doing that type of transfer. So think about it. Like a CNA can do a Hoyer lift transfer. They can be trained to do that. So an OT aide can also be trained to do a mechanical lift transfer. But that's not skilled services. Questions on that? So we're not going to split hairs.
I'm sorry. I'm just a little confused with the OTA and the COTA. I understand what you said. The OTA the OT aide, which would be the rehab aide, can do unskilled services, but I didn't understand what you said, but the difference between the OTA and the COTA.
Okay, we're going to get that. So there's no difference between OTA and COTA.
That's what I thought, but I thought you said that it was.
No, there's a difference between, so I'm using these as synonyms, OT and OTR,
Okay.
OTA and COTA. So the reason why I tend to use OT and OTA is because every time I use OTR or COTA, I have to put that registered symbol because NBCOT has trademarked the R in OTR and the C in COTA. And it's important for you to know that because once you pass this exam and are licensed, some states require that you maintain that certification, but not all states do. If, however, you don't maintain that certification, meaning have the continuing ed required to do that, then you can no longer use the R for OTR nor the C for COTA.
Oh, okay. I got it now. Okay, because I got lost for a minute there. Okay.
Okay. Don't hesitate to ask me questions.
Okay.
So just think about it this way. I can't always say it depends on the person and the situation that when an OT aide can or cannot assist with a transfer. Okay, because that gets way too specific. I can just say that an aide can't teach the person something that would be considered skilled services. They can assist, or they might be, let's say somebody needs a 2-person transfer. They might be able to assist the OTR or the COTA, but they wouldn't be the one directing what's going on. So often it's transportation, it's setup, it's cleanup, things like that. So they are there as an aid to the OT process, but they're not providing any skilled services. Think back to documentation about what language you use for what's a skilled service versus unskilled services. Does that make sense? Like, let me come up with an example. Transporting a person, if we're in hospital, transporting a person from their hospital room to the OT clinic can be done by an OT aide. It does not have to be done by an OTR or a COTA. So that means the person could help the person transfer. That means the aide can help the person transfer from their bed to, let's say, a wheelchair to be transported. Or if they can ambulate using a walker, let's say, they can walk with the person with that walker. Most of the time, for the sake of time, what we do is we use a wheelchair for transport, don't we, for distance. Does that help at all? Just think unskilled services. Now, let's talk a little bit. I'm going to go through the OTR and the COTA, their roles, by going through the OT process. But think about this. The OTR is the supervisor. A COTA, excuse me, must work under the supervision of an OTR. Is that part clear to everybody? Now, how much supervision they need varies. We'll talk about that later. So here's what I think is helpful to go through. You can stop me if you have questions along the way. So let's think about the OT process. Now that's in chapter 3 in both of the review and study guides. So we start with referral, go to screening, evaluation, intervention planning, intervention implementation, reevaluation, or as the OT practice framework calls it, intervention review, discharge planning, and assessing outcomes. And in some lists, you won't see discharge planning as a separate step. I've just put it in here for the purpose of teaching this information to you. So a referral is the way in which a person or a group of people are identified to us as needing OT services. So that's done by somebody other than an OT, right? So we work under the referral of other professionals such as a physician, a nurse practitioner, a physician's assistant. And so typically it'll be a formal referral, but it might be a setting like, say, a skilled nursing facility where everybody who comes into the facility is also screened by OT. So it's called a blanket referral, or I've worked in programs. One of them was a day, an adult day treatment program. And in this adult day program, everybody who joined the program was evaluated, and what they did for their evaluations, they had an OT do it. They had a nurse and an OT do it, which I thought was a novel approach. And so as a consultant, I evaluated each person who came into the program. So the way in which we see somebody varies, the way in which they're referred to us. So a screening, the purpose of a screening is to determine the need for a full OT evaluation. Everybody clear on that one? So look for that in questions. If it says the referral has been, or the referral has been received, the screening has been completed, what do you do next? Well, what comes next is evaluation. Think about the OT process and the sequence in which these events happen. Now, by the way, it looks like it's a linear process the way I have it listed here, but it's actually not linear. It goes back and forth. So I'll talk about that more as I get to intervention. So the screening is to determine the need for a full evaluation. Now, the OT assistant can contribute to the screening in collaboration with the OT. So those of you who are OTs, you need to realize that OTAs are also trained in administering assessments. OTAs, can you help me out here? What assessments did you learn in school?
Manual muscle testing.
Thank you. Manual muscle testing. What about goniometry?
Yes.
What about like the Canadian Occupational Performance Measure, the COPM?
Maybe. I didn't remember it.
Okay, so maybe. Did you learn any specific assessments? Anybody else here to help Mary? Oh, wait a minute. Let me check the chat. COPM, cognitive assessments. So like maybe the mental status. Yes, OTAs also learn theory. Did you know that, everybody? The reason I emphasize this is often my experience has been that OTs don't necessarily know how much OTAs know and can do. And that can trip you up on this exam. So the general rule of thumb is an OTA hold on, Lisa, I'll get back to that question. That an OTA can administer an assessment once competency's been determined. So think about this, that there's a certain base competency that one has just from graduating from an OTA program. So for the MOCA, you do need certification. However, you can do it, I think it's like an hour online certification. It's very brief. Oh, thank you, Carly. So, and many schools are having students do that. So it's not considered advanced practice. Does that make sense? Oh, yes, that's true. And it's free if you're a student. Okay, so remember this, there's a certain amount of certain basic level of competency an entry-level COTA has. And then in addition to that, the rule of thumb being once competency has been determined, who determines the competency? Well, the supervising OTR does. And so if it doesn't say that somebody's is competent to administer a particular assessment, but if it says they're a COTA, that assumes a certain level of competency. So they would be able to do interview, they would be able to do observations, they would be able to administer some of the basic assessments like the COPM. And then the interpretation part would be discussed with the OTR. So I want to give you two definitions here. The first definition is for assessment. An assessment is a tool or a strategy that you use to gather information about a client. Does that make sense? A tool or a strategy used to gather information. An OTA I don't know of any differences between an OTA administering an assessment. So we're going to say assessment, not an evaluation. An OTA cannot independently complete the full evaluation. So let me give you a definition for evaluation in a moment. But does assessment make sense? Assessment is the tool or the strategy being like observation, interview, that's used to gather information about a client. Are we good on that? Okay. And then an evaluation is a process. The evaluation includes selecting the assessments that you're going to use, administering those assessments, and then interpreting the results. That's why a COTA or OTA cannot independently complete the evaluation, because it's an interpretation piece. It's pulling together the results of multiple assessments and interpreting what that means in terms of the person's occupational performance. So that's that occupational performance analysis. Are you with me? So assessment is the tool or strategy. Evaluation is the process of selecting assessments, administering them, and interpreting the results. So an OTA or a COTA can contribute to the evaluation, but they cannot independently complete the evaluation. So if you have an exam item that talks about which of the following is appropriate for the OTA to do, completing an evaluation would be a no. All right, hold on. Let me just go back up here a little. Oops. Okay, so I don't know why Carly has a question here. Carly, I don't know why that OTA said she wasn't coming because she doesn't administer assessments. It could be that facilities role delineation. It could be that state. There are some differences. So I'm saying in general, an OTA can administer assessments once competency has been determined. And doing a hands-on training session is a perfect way to gain that competency. So was it that just that OTA who didn't want to learn, didn't want that responsibility? Was it that facility who said, nope, this is what the role of the OT is, this is the role of the OTA? It varies so much. Any other questions? So let me scroll down. So an OTA cannot complete the evaluation independently. They can contribute to it by administering an assessment or assessments. Then they take the information that they gather by administering the assessment and collaborate with the OTR to interpret the results of that assessment and how it fits in with the rest of the assessments that were administered. They could do an interview to complete the occupational profile, to contribute to the occupational profile, but they have to then talk to the OTR about the results of that. They cannot do it independently. Same thing with the reevaluation. An OTA cannot independently complete a reevaluation. They can contribute to it. So, evaluation, who has primary responsibility? The OT does. The OTA can contribute. Intervention planning, primary responsibility is the OTR. Therefore, if you have a question that, I don't know, let's say something changes, there's a status change or a functional change with the client, and it says, what should the OTA do? The OTA cannot change the intervention plan independently. They have to collaborate with the OTR to make any changes to the intervention plan. So see how that might be built in there? But you have to think about it that way. Even if the OTA is the primary one given the intervention, they cannot change the intervention plan. They follow the plan as completed or as established by the OTR. So intervention planning sometimes it's considered a separate step, but think about it. It actually comes at the end of evaluation, where you're determining what are the client's goals, what goals are reasonable within, given the setting and given the person's overall occupational performance. So it's setting goals, it's determining what methods you're going to use. So what's the intervention you're going to provide in order to reach those goals? And of course, it's documenting it always and forever, right? All throughout the OT process, there's documentation. All right, let me just check this. So the OTA cannot independently set goals. And it's not just the OTR signing off. Some facilities require that the OTR sign notes as a way of demonstrating supervision. The only thing an OTA can do independently is to provide intervention, but they're providing the intervention as determined by the intervention plan. Now, remember, all of this should be a collaborative process. It should not be the OT just saying, okay, there's the results. Now this is what you're going to go do. It's a collaborative process between the OT, the OTA, and the client, and family if appropriate. Okay, questions? Laura, was that a question? Already planned intervention. Okay, so then intervention implementation, and OTA can independently implement intervention. So sometimes the OT provides the intervention, other times the OTA does. It depends on the setup and the caseload. But an OTA can independently provide intervention. Now, they're always working under the supervision of an OTR. Remember that. And how much supervision varies. We'll get to that. So intervention review, primary responsibility is that of the OTR. But think about it. The OTR really wants to collaborate closely with the OTA if they're the one who's providing that intervention. Because just re-administering assessments that you used in the beginning for your evaluation isn't the same as seeing that person day in, day out. So again, this needs to be a collaborative, interactive partnership. Okay, so I can discuss service competence OTAs right now, and the supervision requirements. I have a slide at the end. Okay, so service competent OTAs means that the OTR has determined that this person is competent to provide a particular type of service, whether it's administering an assessment or particular intervention. There might be some intervention that the OTR doesn't think is appropriate for that particular COTA, and that they're going to provide that. But that competency is varied depending on the setting, the situation, the client's needs, the level of severity of their condition and situation, particularly medical status. And the OTR is the one who determines service competency. And how do you do it? By watching the person do things. If it's an assessment, maybe you administer assessment, you as the OT administer an assessment, and then you as the OTA also administer the same assessment, and you compare results. Are they similar? Does that demonstrate competency? Okay, does that make sense? So competency is a vague term, but it means that you have the knowledge and the skills in order to safely and effectively provide a service, whether it's contributing to the evaluation or its intervention. So remember, safe is a big deal. So the intervention review or the reevaluation, the purpose of that is to determine a few things. Is the plan working as written? Are they making progress? Can we keep the plan as written, or do we need to modify it? Maybe we need to modify it. Is the person not making progress? If so, why not? And is it time for discharge? So if it's worked so well that now the person has met all their goals or most of their goals, it's time to do discharge planning. So remember that discharge is a process. It's not an event. It's not like, boom, you're done. It's a process by which we start decreasing the client's reliance on us as an OT or an OTA, and we prepare them for the next step, whatever that next step is, wherever they're being discharged to. And we want them to be able to be ready to meet that criteria. If it's admission to a different facility, they have to meet that admission criteria. If it's discharged to home, they have to be safe to do that, whether it's to live alone or live with family, live with caregivers. So we want to make sure that their health and safety is the primary driving force in discharge planning. Now, I'm talking the ideal situation. We know that there are times when a person has to be discharged from service because, let's say it's home care, and the insurance will pay for X number of sessions, and that's it. When you're done, you're done. Does that make sense? That sometimes it's not that they've met all of their goals, it's that that's how much intervention the insurance will pay for, and the person may not want to do full pay. Okay, but for the purposes of this exam, think about it more in terms of the book answer. What would the book say? Well, the book would say you don't discharge the person until they're safe to go to the next level of the next setting, whether it's home or another setting. So what should be in the discharge planning? It should be helping the person transition to the next level of care, whatever that is. Does that make sense? Sometimes, like if it's acute care, it might be rehab. It might be discharged directly to home. It might be a skilled nursing facility. So we want to help them meet that admission criteria. We want them to be safe. We want them to reach their goals. How do we wrap that all up? And what will, as part of discharge planning, we're also going to have, are there any referrals that we need to make for them? Like, let's say, for example, as an entry-level practitioner, you would not do something such as driving rehab. But if the question says something about you find that the person's not, you suspect that they're not safe to drive, but you're doing discharge planning, one of the things you would want is a referral to a driver rehab program for evaluation and possible intervention. Okay, does that make sense? So discharge planning is planning for them to safely gain as many skills as possible to move to the next level, whatever that level is. And assessing outcomes, we actually start thinking about assessing outcomes when we do the evaluation, because sometimes assessing outcomes, what we're doing is we're using the same measures that we used as assessments for our evaluation. For example, the COPM has shown to have very strong retest reliability, so that's one of the tools that you can use before intervention and then after intervention to help assess outcomes. So how do we assess outcomes? It varies depending on what we're trying to do is to determine, has the person met all their goals? If so, what helped them to do that? If not, why not? So it's assessing those outcomes, and it's of course documenting those. So what was the effectiveness of the services that you provided for that individual? And then also going back to that discharge planning, what still needs to be done? Do they need more occupational therapy in the different level of care? So like if they're in acute care hospital and being discharged to home, do they need home OT? What are you going to refer them for? What's going to make sure that they're at the highest level function possible and that they're safe? Health and safety is a really important thing for you to consider with any of the questions on the NBCOT exam, because it's important that you do no harm. The bottom line for entry-level competency is do no harm. So think about that for every question on your certification exam. Is there a health and safety issue here? And if there is, address that first. And remember, you're always going for the book answer. It's not what do you think you would do or what did you do on your field work. as much as it's what does the book say you do first? What does the book say you would do next? What would the book say is the best thing to do? That's the way in which many of the questions are written for this exam. So you need to begin to think that way. And therefore you need to think about what your experiences were as compared to what does the book say you would do. That's why it's so important for you to do a thorough review of content so that you're enmeshed in, you're thoroughly ingrained in what the texts say is the best thing for you to do. So let's talk about supervision. So if you take a look at this, now this is, oops, let me check the chat. Okay, thanks, Lisa. You can look at all this information later. It's on page 73 for OTAs and 75 for OT. That chapter 4 is just packed full of good information for this domain. So if you take a look at it, it talks about entry level, intermediate level, advanced level for both the OT and the OTA. But I want you to think about this. What type of supervision is required is not based on how many years or weeks or months you've worked in a particular setting. It's based on your level of competency and the level of acuity or the degree to which your clients are at risk. So I have more than 40 years of experience in occupational therapy, but if I were to go work in a NICU, I would need close supervision. Even though I'm not entry level as a whole, I would be entry level in a NICU, and it's a high risk population. Does that make sense? I could do harm. So I would need close supervision. Does that make sense, everybody? But if I were to go work in, let's say, an adult day program or a skilled nursing facility, I would need general orientation and I would be fine. I'd probably have to learn their electronic record system and what the roles of the different disciplines are in that setting. But I would be competent to work with that population. Okay, so I think that you should focus mostly on the entry level for OT and the entry level for OTA, because that's what you're going to be answering questions as. You're answering questions as the entry level. Can the COTA administer the AMPS? Well, the AMPS requires special certification. So that what we mean by assessment of motor and process skills. So the AMPS requires certification. Therefore, that's not entry level practice. Okay, so you would not see that on this exam. Okay, does that make sense? So the level of supervision somebody needs depends on the setting and the level of competency in that setting with that population, not however many years you've worked. And think about it. If you're entry level, you're going to need much more supervision than if you are advanced level. And look at the bottom here. It talks about personnel other than occupational therapy practitioners assisting in OT services, non-client related tasks. So that they're not doing any skilled services like we talked about before. So think about this. Even an entry-level OT can supervise any level OTA and aides technicians and level 1 fieldwork students. After you've been in practice for a year in a particular setting, at least a year, then you can supervise level 2 fieldwork students. Now, an entry-level OTA, you can supervise aides, technicians, volunteers, and after you gain more experience, you can supervise other OT assistants as well, but not as an entry level. Because think about it, as an entry level, you're just starting your career, whether you're an OT or an OTA, you're still learning and you still need mentoring and more practice to learn, to refine your skills. You graduate with the basic skills, but there's so much more to learn, isn't there? All right, so as you know, the OT exam item of the week always relates to this topic. I'm going to put up the poll. You may or may not have seen this on Facebook, Instagram, or Twitter. But these questions are posted every Thursday. And then on Sunday, the answers are posted. So we have 8%. Anybody else going to jump in? Oh, we're up to 10%. So while you're answering this, I also want to let you know that this is being recorded. It takes approximately 2 weeks for it to be reviewed and edited. And then the recording of this office hour will be available on the Therapy Ed channel on YouTube. And then it will be available for 1 month. We don't keep them up infinitely. So it's 1 month. And the reason for that is because we rotate these and we'll be doing the same topic at a different time. So I know sometimes you can pick up the information quickly when it's live, and other times it's very helpful to have it recorded so that you can have the book in front of you. This information is taken directly from the Therapy Ed Review and Study Guides, the one for the OTA and the one for the OT. So I like that they're stored on YouTube for a month, because then you can look at the content in your book and listen to it. Okay, we're up to 70%. All right, last chance, everybody. Let's see the results. All right, so the majority are saying B, but we also have C and D. When we got rid of A, that's a good thing. Let's take a look at this. I'm going to read it out loud. Sometimes that helps you to process it. An occupational therapist and OTA work for a home care agency which delivers interprofessional services. The OTA provides interventions to help a client regain independence in activities of daily living following a hospitalization for a stroke. During a session, the client states the agency nurse had changed the occupational therapy home program activity protocols. After the intervention session, which action should the OTA take first? A, submit an incident report about the nurse's actions to the home care agency director. Okay, everybody got rid of that one. That's a good one to eliminate, because an incident report means something happened and the client got hurt. There's nothing here. There was no incident that happened. Okay. B, consult with a supervising occupational therapist to determine a course of action. C, discuss the client's statement and the OTA's concerns about this action with the nurse. D, document the situation and the nurse's action in the client's electronic health record. Well, I'm going to eliminate D because that's a passive answer. It doesn't actively change the situation. Would you also document? Yes. But what's most important to happen here is C. The OTA should discuss the client's statements and their concerns, the OTA's concerns about this action with the nurse. So as an entry-level practitioner, whether you're an OT or an OTA, you are expected to be able to confront and resolve issues with clients, supervisors, co-workers. So, and you're expected to be able to take independent action. So you should be able to identify changing the OT home program is not within the scope of practice for a nurse. So first of all, the OTA needs to discuss it with the nurse and then discuss it with the OTR. Does that make sense? So see where B was consult with a supervising OT. First of all, you want to discuss what happened with the nurse. That gives you more information, so you're more fully informed about what happened. Questions on that, anybody? Yep, think chain of command here. Also, think about this first. How is a issue best resolved? So an issue or a disagreement, a concern is best resolved, most effectively resolved between the two people most closely involved. In this case, it's the nurse and the OTA. Yep, go to the source first. So talk with that person first and find out what's going on. And then, because an OTA works under the supervision of an OTR, you would want to discuss that with the OTR. Okay, so first of all, you try to resolve issues directly with the person involved. If that doesn't work, or like, let's say something happens again, then you follow the chain of command. Any questions on the role of the OTA and the OTR? Now realize that often in answering questions on this exam, you have to figure out what the question's asking. Have you found that out? Like, well, I could have answered it if they'd asked it in a way that I understood. That sometimes it's just figuring out what's being asked. Okay, so I do want to tell you we have some other things. We're over time, so I'm not going to go in depth on this, but we do have exam preparation courses. So it's a 1-day course for OTAs and a 2-day course for OTs. And I have some, that says about 2019. I do have some more current information too. Okay, so please realize that if you've taken the exam preparation course and you want to take it again, you've been delayed for whatever reason, that you just need to contact the office and look at the list of courses and say, this is the one I'd like to register for. There's no cost for a retake. I like that. And then the online office hours are every week. So thank you for joining me tonight. I really enjoyed doing them, and I'm really pleased to be able to spend an hour with you. We also have one-on-one tutoring. I'm one of the tutors. And that's if you have specific needs that you want addressed, that you want somebody to give you more specific feedback about how you're answering questions or how you might develop your preparation plan. And there is a fee attached to that. These are the topics for upcoming online office hours. We have a new resource you may or may not be aware of. It's the mobile app. So it has, for the OTA, it has the multiple choice questions. I should have one for each one. I apologize for that. So for the OTA, it has the multiple choice questions. So what would it be? 600 multiple choice questions that are in the OTA review and study guide. And then for the OTR, it has 4 new clinical simulation test items and 510 multiple choice, the same ones that are in the review and study guide. So it's at a discounted rate right now until Therapy Ed updates all of those questions. Okay. So the app questions are the multiple choice are the same as the ones in the book. For OT, the clinical simulation test items are new. So they're different than the ones. Lisa.
Are they the same as the practice tests? Or
Yes.
are they? So the practice tests that we have 3 practice tests. If I went and I did the app, then I would be kind of wasting my practice test.
Well, you're not wasting them. It's a different way to receive them. The thing I like about the mobile app, and I'm not trying to sell you guys anything, but what I like about the mobile app is that artificial intelligence will give you, it'll track your progress, and it will give you a study plan for where you go next. Okay, so it generates custom study sessions based on how you've done in the domains, different categories of content, and your critical reasoning strategies. So it helps you interpret the information, your results, and plan based on that in a different way than it does in the book.
Thank you.
Okay, so you have the app?
Oh, I was thinking about doing it.
Oh, okay. All right, so these are the review and study guides. I'm not going to read all of this to you, but please realize that the review and study guide is both content and the questions with answers and rationales to those. Do take the exams online or using the app, because you have to answer them electronically when you take the actual exam. Okay. Make sure and pay attention to the green boxes, the exam hints, the orange boxes, the caution boxes, and the red flags, because that tells you what's most important to study for this exam based on NBCOT's practice analysis, the information that they've released. So all of that information in terms of the percentages of what's expected on the exam is valid up until January 2024. They're changing the exam a little bit. So it's not going to be a significant change, but the percentages are changing a little bit across the domains. It doesn't change the way you get ready for this exam, everybody. All right, there's also ebook features that you might like. It depends on what you're looking for. So don't buy the app if you really like using the online exams and you like reading the rationales and highlighting things and underlining them and all that. Don't buy the ebook unless you want things like text to speech. If you want to be able to highlight and take study notes, you highlight certain parts of the text and it will make your own study notes or make your own flashcards. Okay, so you can search for certain words and phrases. So as with any ebook, it's not just an electronic version of the book, it has all these different features too. For some of us, that works really well and we love it. For others, it's like, oh, no, 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 I want that book in my hands. I want to read it. I want to touch it. I want to write in it. Okay, so these are the results. So a high percentage of people who take the course would recommend it to someone else. So 2% said no for the OT course and 3% said no for the OTA in terms of recommending it to someone else. So it's a high percentage of people who do recommend the course. Do look for the free questions each week on Facebook, Twitter, Instagram. Okay, any last questions for me about anything in general? How to do a study plan, how to answer questions.
I have a question.
Okay.
My question may be like a little weird, but I just wanted to know your definition when it says apply pragmatic reasoning.
So pragmatic reasoning has to do with the facts of the situation.
Or meaning like when they, because it says and by the book. So I'm like, is it so just meaning everything is true? Because I'm a little confused with that. So that's why I wanted to know.
Yeah, so it would be the facts surrounding the situation in an exam item. And the concrete knowledge you have of the setting of the client and of the situation.
Oh, okay. Okay.
Okay.
Okay, that's a little better.
What is considered a conservative intervention? So conservative meaning least invasive is the first thing that comes to mind. So how do I define conservative intervention without using conservative? The most direct approach and the least invasive. Does that help?
Yes, thank you.
Anybody else want to add to that as to how would you define conservative intervention? Are we good then?
Say a way to implement interventions before surgery is called on.
Yeah, see, that's where I fit in with the least invasive. So like if a conservative intervention might be OT doing something like, let's say for somebody who has carpal tunnel syndrome, conservative being we're going to do OT intervention to try to lessen their symptoms as compared to having surgery. Not that we're doing the surgery. Anybody else? Well, I'm going to wish you the very best on this exam. Please realize everybody has an equal opportunity to pass this exam. Make sure to study it very well. It's important that you do that. Remember that the Therapy Ed Review and Study Guide does not have all the details. It's an overview of what you need to know for this exam. But you have other resources. You have class notes. You've had this information before. You have class notes. Hopefully you still have textbooks, whether they're electronic or hard copy. Look at those as well. This is the Therapy Ed Review and Study Guides considered to be used as the primary resource for your review, but not the only resource. On the other hand, don't overwhelm yourself with resources. It's very easy to have a little bit of everything, and then you're so overwhelmed you don't know where to start. So I'm wishing you the best.